I'm Ryan Wood. This is my trach care and suctioning video. So to first come in, I would introduce myself to the patient, provide patient privacy, and first get the patient's name and date of birth, and just verify that the patient needs suctioning. And by that, I would auscultate the lungs and just talk to the patient and see that they're having difficulty breathing, so that they're going to need some suctioning and have that trach care done. So at first, I would put the suctioning on 80 to 120 and then put their oxygen level up. So I would hyperoxygenate them. So when I would make sure the oxygen is nice and secure, getting my suction catheter ready, and before anything starts, I want to make sure that I have an obturator and a smaller size trach, so that if the patient's desatting or something would go wrong, then we would have these for safety. So to provide suction first, I would perform hand hygiene, open my suction kit, put on sterile gloves, like that. So now my hands are sterile, and prior to this, I would talk to my patient, discuss with them a way of communication, so that when we're suctioning, they can raise their hand, or if they feel like they can't, something's going wrong, or they just to have that established level of communication. So then I would open up my suction kit, get my suction in my hand, and then I can remove the oxygen with my left hand, my non-dominant hand. Tell the patient to take some deep breaths, so that way they can get that breathing routine in. Apply my suction catheter. Now my left hand is not sterile. I can remove the oxygen and I can make sure that my catheter is working just by putting some intermittent suctioning. Tell the patient that they're going to feel some irritation, so I'm going to insert the catheter, applying no suctioning at all, and then once I hit resistance or the patient starts coughing, then I can stop, remove the catheter about 1 to 2 centimeters, and then slowly apply intermittent suctioning as I remove the catheter for approximately 10 seconds as I remove it. And as I'm removing it, slowly rotating the catheter so it doesn't cause any damage to the trachea at all, or the airway. So as this is occurring, and then if I do another pass, then I would put the oxygen back on the patient, and then I can rinse out the tubing. It just depends on the patient and as needed, but typically we can do it as 3 passes. So when I remove this, since my hands are now not sterile, I can remove the dressing as well, putting all this in the trash. So next, I would remove my sterile gloves, wash my hands, put on new, and then while my hands are clean, but for the sake of the video, I'm going to keep my sterile gloves on. So I would open up my trach care kit, establish my sterile field, making sure to keep my sterile field sterile and only washing the borders. Then I would put on sterile gloves, and then I can get my field ready. So with this, I would have normal saline, so I can open it and pour half of it in one container and then half of it in the other, and then throw it away. And then with my hydrogen peroxide, I can tear it open and put the entire thing in one of the normal saline. So it's half normal saline, hydrogen peroxide, and the other half is just normal saline. So with that, I can tell the patient to take some deep breaths, because I'm going to remove their oxygen, take off the inner cannula with my non-dominant hand, placing it in the half normal saline, half hydrogen peroxide, letting it soak, and then taking it out, grabbing my dominant hand and then cleaning it thoroughly, getting all the gunk and all the just all the secretions and everything out of the inner cannula, making sure it's very clean and not putting it over my sterile field. Then I can drop that and then put it in my normal saline. Then I can grab it with my dominant hand that's now sterile, and then rinsing it out, tapping it against the side, and then putting the inner cannula back into place. And as well, since I want to look at the site, if there's any signs of drainage or if there's any gunk around, then I can get my my gauze, soak it in normal saline, getting it nice and wet, and then cleaning the area with this gauze, making sure everything is nice and clean, and then getting my other dry gauze, and then drying it so it's nice and good. So then next, I would apply the V gauze. So I would take off my sterile gloves, wash my hands, put on new sterile gloves, and then get the V gauze right here, as so, and then putting the gauze as so right tucked underneath the trach, and putting it underneath the ties as well, limiting as much contact to the skin as possible, staying sterile as possible, and making sure that the trach stays secure at all times. And then once I'm done with that, I can put the oxygen back on the patient, throw away any other unnecessary applies, and then I can assess the ties around the trach, and if they're soiled or there's something on them, then I can remove the ties. But these are clean, so I do not need to remove the ties at all. And then now that the patient has received full trach care, and then before leaving, I can assess the patient's lungs, how well they're breathing, and before any of the procedure, if there's any sputum or anything, I can put it into I can culture it and send it to the lab. And then ask the patient how well they're breathing, check their oxygen levels, and then before I leave, ask the patient if they need anything, and making sure that the obturator and smaller size trach is still in the room. And I'll document how well the patient took the procedure and when they are needing their next suction.